Greeting mentor colleagues. I'm very pleased today to introduce Skye MacKennon. She is a pharmacist and clinical associate professor at the Washington State University School of Medicine and has been involved in the past with the admissions committees at the University of Utah School of Medicine, as well as the University of Washington School of Pharmacy. So I'm very pleased. She's just going to talk to us today about some of the general points of pharmacy if our mentees are interested. So thank you, Skye, for being with us.
Oh, my pleasure.
I just wanted to start off and ask, what led you to decide on pharmacy, and what are some of the things that you love about being in pharmacy?
Well, I think that my interest in healthcare started at a young age. I had an immediate family member diagnosed with aplastic anemia when I was in elementary school. And so I was exposed to a lot of healthcare pretty early, being in the hospital. I still remember going to, get my bone marrow tested to see if I was a match and doing all these things. But I remember through the course of treatment that while lots of things made a huge impact, the medication that my family member used really helped change his outcome and his trajectory. And that was really fascinating to me that there was so many things that went into it, but medication played such a huge role, and that got me interested in pharmacy. And we also had a family friend who was a pharmacist, and she absolutely loved her job and was so happy and was really encouraging and gave me some good opportunities to shadow and be exposed. And what I think I like about pharmacy is that there's so much, I guess, you can do with your training. There's things that people think about traditionally, like working in a community or retail pharmacy, but there's so many things beyond that as well. There's working in hospitals, which I've done, working in ambulatory care clinics, so working one-on-one with patients, helping them achieve their health goals, and even academics, which I do now, which teaching, which I absolutely love. But really, there's just so many opportunities, whether it's, hospital, ambulatory, community, industry, research and development. There's a lots of ways your career can go depending on what you're interested in.
Excellent. Thank you so much. Are there ways then that the students can start to get exposed in pharmacy and get a little bit of a picture of what it's like?
Yes, and I think that is the best thing to do to determine if it's something you're even interested in, is to go experience it for yourself. So I would encourage interested students to reach out to, whether they're interested in community or hospital or ambulatory care, to reach out to pharmacists or clinics to see if they can do shadowing or even volunteer opportunities, because then they can actually, be in the pharmacist's shoes and experience and see what it is that they're doing. And of course you can look online and read and look at videos, but I think having your boots on the ground is the best way to see if, like, this is for me, yes or no. And if that's a little bit harder or you're not quite ready for that, even just talking to current practicing pharmacists, I think, is another great way. I think pharmacists always want to help people, and they're happy to help students that are interested in their profession.
Thank you. Hearing that the volunteering is kind of an interesting idea. Are there have you seen students doing volunteer activities in these pharmacy settings?
Yeah, I have. And what I've personally seen is in the hospital setting, volunteers. So students can volunteer actually in the inpatient hospital pharmacy. Of course, legally, there's restrictions on what they can and cannot do. But that way, they're actually in the environment, doing things, working with the pharmacists and pharmacy technicians. And that's, I think, a fun way. And I think that practicing pharmacists and technicians really love to have student volunteers.
I'd imagine, and just kind of in between, whatever they're doing for their volunteer activities, just sort of talking to them about what their experience has been in pharmacy is probably sort of huge for getting exposure to the field.
Yes, absolutely. Absolutely.
Thank you. And are there sort of certain requirements for applying to pharmacy in terms of majors or research or anything like that?
There aren't like a specific major that is required. Typically, and I want to say I can only speak for the schools I've experienced with, but there isn't a specific major. There are, however, prerequisites, things like chemistry, organic chemistry, some math, biochemistry, courses that need to be taken before you apply. But so as long as you've met the prerequisites, a variety of majors are encouraged. And my experience on admissions committees is we really love seeing people with a variety of backgrounds, because that makes for a richer student body and a richer experience for everyone.
That's good to hear. Yeah, because sometimes in medicine, like there'll be students who perhaps weren't even in the sciences, who were, history or political science majors or other English majors. Are sort of all majors considered, I guess, as equally in applying to pharmacy school, as far as you know?
In my experience, and when I've been on committees, I think that they're seen as, I think, equal, or maybe even, I think that having maybe a non-traditional major can actually make you a more unique applicant and more memorable. I have a friend who graduated from the University of Washington School of Pharmacy, and she was a German major as her undergrad. Wow. Yeah, she had a German major, and she was a wonderful student. And so I think it just
yeah.
It makes you more unique, I think.
Yeah, and I would think that maybe a student who didn't have a traditional major, but really in their story can kind of talk about what led them to pharmacy, really sort of shows a lot of maturity.
Absolutely, absolutely.
And then how can students learn about like different pharmacy choices and maybe some of the like nuts and bolts of applying to pharmacy school?
Oh, sure. And, I'm sorry, I didn't actually fully answer your question. I think you had asked about research activities too.
Oh, yeah.
So let me, there is certainly not requirements to have research or other activities, but I do think those things can strengthen your application. And especially showing that you've been involved in a project from the beginning to the end, or maybe involved, once again, it's certainly not required, but it can strengthen your application if you've been involved in other activities. And then I think a lot of programs value experience in pharmacy, whether it's volunteering or shadowing. I think they want to know that you have investigated that this is the right choice for you.
Good, thank you. Yeah, and then so just my follow-up question to that is like, how do they learn more about the actual application process in maybe some of the schools that are out there?
Oh, sure. So I think the admissions process will vary based on the program to which an individual is applying. There's some generalizations I can walk you through, but of course, each program or school might have their own situation. And then just maybe to quickly back up, many schools, particularly on the West Coast, are four-year programs that students enter after completing their undergraduate prerequisites. So, you do your prerequisites, oftentimes having, not always, but oftentimes having an undergraduate degree or finishing that degree and then applying for four-year pharmacy school. However, there still are some six-year start to finish programs out there where students would enter during kind of like their typical like freshman or first year of undergraduate, and then they would complete everything within 6 years. So there are still some of those six-year programs out there. But for those four-year programs, right, a student would complete their prereqs and then take a standardized exam, which is called the PCAT. Now, it's a little different because not every school requires the PCAT. I think most recently, 85% of schools did require a PCAT scores to be submitted for application. And so that is something you would do. And then after you took your PCAT exam, you would use this centralized application service, which is called CAS, Farm CAS. And that would allow the applicant to apply to multiple schools from that centralized location. And every school has a little bit different application requirements, but it's pretty safe to assume you're going to need to write a personal statement in addition to other application materials. It might be a vague one, or some schools have more specific ones that ask specific questions. And then after that point, schools would then invite potential students to interview, and these interviews vary in length. And then I think with the current situation we're in, I think most things are being done virtually right now. And then after a certain date, students would be offered admission or not. And some schools do offer an early decision or early admission process. Not every school, but some schools do have that as an option as well, where you would find out, in the fall, whether you would start for the next year versus the spring for the next academic year.
And then is it similar to med schools, how there are state schools like the University of Washington that sort of look at a lot of our in-state students as well as private universities?
Yes, absolutely. So there's both state schools and private schools. In Washington state, we just have two state schools. We have WSU and University of Washington, but there are lots of private schools in other states throughout the country.
Okay.
But there are, yeah, both state and private.
And is there like a website that sort of talks through like the application process and some of the schools that are out there?
Yes, so the American Association of Colleges of Pharmacy, or AACP, they have a resource page for future students. They have current and future students, but the future student website gives you information on the application process. Is pharmacy right for you? Information on, the exams and that PharmCast website, the centralized website that I was telling you about. And then it shows you all the accredited pharmacy schools in the United States. So all the schools that are accredited, private and public.
Excellent. Thank you. And, is there sort of any other general advice that you have for our mentor group as they're helping the students with this journey?
Oh, sure. I think just helping students get practical experience in pharmacy, just like anything else, to make sure they really like it. Because I think the worst thing that could happen to someone is they get into school, or they get to the end of school, or they get to their clinicals and they realize like, oh, this isn't for me. So helping them get some experience and really assessing the benefits and the drawbacks. Because I think every profession, every health science profession has both, right? There's wonderful, enriching things, and there's things that are more challenging. And I think sometimes we focus on like all the wonderful things, but I think it's also good to understand the other side of the coin sometimes too, so that students are coming from a really realistic place to enter the profession. And then I think helping, particularly for pharmacist students, see the wide opportunities and possibilities that are out there beyond what I think people traditionally think of, beyond, and maybe they want to do the traditional thing, and that's wonderful too. But there's other options besides, working in a community pharmacy where you're dispensing. And really it's state specific, but like in the state of Washington, pharmacists can actually prescribe under protocols, they can prescribe medication. And so there's a variety of states where that can happen. And so I think that it's important for students to understand those possibilities. And then I think offering assistance in reviewing application materials or personal statements is helpful. And I know lots of healthcare providers are, but pharmacists are stereotypically detail-oriented people. So dotting, helping them make sure all their communication and application materials, all their I's are dotted, all their T's are crossed, because I think pharmacists.
The committee members will be looking for those things probably.
Yes, because as a pharmacist, that's a good skill set for your job.
Yeah,
but
being meticulous.
Yes, but I think that stereotype holds true.
And then you mentioned that clinicals, do they get exposed to some of the different possibilities in pharmacy through the clinical years then?
Yes, and different schools do it differently. But I know for like the University of Washington and WSU, because I teach in both programs, their students, their entire fourth year is clinical based. And then throughout their introductory years, they have clinical like longitudinal clinical experiences. So they have chances kind of early on that are more introductory, but the last year and lots of times in the summers, you're actually going for 4 or 6 week rotations at different practice sites throughout the state.
Wonderful.
Which is good. I wish they could do it earlier, but start earlier.
But like you said, even just reaching out and trying to talk to some pharmacists, maybe even in different areas, I think would probably be helpful for the students, just to get kind of a little bit of an idea of what their career might look like.
Exactly.
Well, thank you so much for your time today and all the information. It'll really help out our mentor program.
Great, my pleasure. And I'm happy if people have questions, if they want to reach out to me, or I'm glad to help make connections if that's helpful for the mentors.
Thank you. Yeah, we are building this system. So the more connections we have, the more helpful it'll be for the students.
Good, wonderful.